Here.
It's these small moments.
All right, there we go. Ready? 3, 2, 1.
That Katie Johnson cherishes.
My son has an idea. He's 5, almost 6 now. But he knows what's going on. We've been open with him, don't want to hide anything. Yay.
In May, Katie and her family drove to the closest hospital, hoping for a treatment on a sore throat from COVID.
You gonna come down? And then we all went over to the hospital. I want to say we were at the hospital at like 3, and maybe about 4 or 5, they were telling me I had leukemia. So, oh, wow.
Acute myeloid leukemia usually affects adults older than 60 years old.
You want to go up here?
Katie is 42. The rare blood cancer's 5-year survival rate, just 30%.
I kind of had I have an idea of what's going to happen.
Still,
Hey, baby!
she puts on a brave face for her 2 kids.
I don't like things getting me down, because if I only have a little time left, I need to do good things with the time I have left and not sit down and feel sorry for myself.
Doctors diagnosed Katie here at Southampton Medical Center. She believes without the hospital and its staff.
I don't know what would happen. No, I feel like I owe them my life. If I'm being honest, they saved my life that day.
But it's hospitals like Southampton Medical facing an uncertain future. Life moves slow in rural Virginia. Roughly 25,000 people call the city of Franklin and surrounding Southampton County home. And for many, Southampton Medical is the closest and maybe only source of emergency medical care.
Country life.
It's here where Michelle Underwood gets critical care for her aging father, just a short drive from her Cortland home.
And taking care of him. The best care that we get, and all of his doctors are in Suffolk. All of his doctors want blood work on a regular basis, or MRIs on a regular basis. He's already had 3 since October. Blood work, we've probably been there 5 or 6 times. He had an incident in January that caused EMS to come and take him to Southampton. Yeah, so we have a lot of familiarity with them, but it gives us, as much as he needs his blood work and all these tests done, rather than drive an hour, I can drive 20 minutes.
Her dad's declining health places her at Southampton every month, and any risk of closure could upend her life.
I didn't know about that. I haven't heard about that, but that's alarming.
Until I just said it, or until
until you said it. I didn't know that's why you were doing the round table with Senator Warner.
Oh, okay. Well.
That's awful sounding. Ooh, I hope not. We're gonna have problems out here.
A letter penned by U.S. Senate leadership identified 338 rural hospitals across the country at risk of closing or cutting services as a result of the Trump administration's latest budget bill, which includes almost $1 trillion in cuts to Medicaid and the Affordable Care Act. 6 of those hospitals are in Virginia, including Southampton Medical. Citing the Center for Health Services Research at the University of North Carolina, Southampton Medical is one of 132 rural hospitals in the country with 3 consecutive years of negative margins. Congressional leaders fear more losses in revenue through the funding cuts could affect the hospital's ability to operate.
Thinking that's going to be so hard and so many if the hospital closes. It is utilized by all of us rural people out here, they don't have anywhere else to go. Where are they going to go? A lot of people who I see coming in and out of the hospital, handicapped, elderly.
In rural healthcare, there's already kind of an attitude of, there's already an understanding that we're underserved as it is. And so many patients do not seek the health care that they already have available to them because there's simply a culture out here of it is what it is.
Dana Stallings runs a diabetes clinic on the edge of Franklin. She warns of what would happen to a population already medically vulnerable without the hospital.
A lot of our patients, we don't have an urgent care out here. And so we used to have one across the street. It closed many, many years ago. And so the only emergency care that residents can get is the emergency department at Southampton Memorial. If they have to go further than that, a lot of our patients don't have transportation. They don't have the resources to go 30, 45 minutes up the road.
Outside of Franklin, there are few alternatives.
Southampton Memorial has been shutting down slowly but surely over the last several years anyway, just like we don't have any obstetric or gynecology service out here, and so patients have already over the last several years had to start the commute to Suffolk just to, have basic screening and preventative care.
Southern Virginia Regional, another Bon Secours facility in Emporia, is 36 miles away. It's also one of the 6 hospitals in Virginia at risk of closure. Obacy Hospital, a Centera facility, is in Suffolk, another 40 minutes away in the opposite direction. To get there, extra time that some consider a life-saving difference.
Yeah, hold on to that.
Lauren Olson is someone who knows how precious those spare minutes can be.
I ended up having a heart attack. I was driving my daughter to school, and I started having really bad indigestion. And then after I took my other daughter home, I started getting like a pain in my arm, and then I started throwing up. So I was like, well, that's serious because I never really get sick like that. So then I was like, okay, I'm gonna go to the hospital.
She received treatment minutes later, driving to Southampton just down the road.
Thankfully, it's only a 5-minute drive, because if not, I probably I don't know what would have happened.
These stories offer just a glimpse into how rural Virginians rely on this care.
And they depend on that. Yeah. We kind of depend on that right now. We've been, at least in the last 8 months, we've probably been there 12 times.
But having them there to treat me if I'm in a critical spot was nice to have it's a nice cushion, you know what I mean? It's nice to know they're there if I have an emergency like that again.
Despite doubt over the future of rural hospitals, some of them may get a lifeline. To avoid a rural healthcare crisis, the Trump administration paired cuts to Medicaid with the creation of a $50 billion rural hospital fund. Virginia's Secretary of Health submitted a $1 billion application to upgrade rural healthcare in the Commonwealth. The $1 billion application addresses rural health shortfalls in 4 categories. $400 million would go toward mobile healthcare expansion, preventative visits, and telehealth appointments. Another $132 million would be set aside for keeping and retaining physicians in rural communities. But it's unclear how much each of Virginia's 6 at-risk hospitals would get if the state is approved. So for now, Southampton Medical's doors are still open, with a hope that doesn't change. Alex Littlehales for 13 News Now.